It's your call, Ms.
Going in
Foxworth.
numerical order.
You're in charge.
So House Bill 288, ideology, compact, ideology and speech language pathology compact. This is identical as well to the Senate cross file. The kind of routine with this one is similar to the last. We could not place this on the consent calendar list because of lack of unanimity. Not sure who voted against, but one or two members did. And so we can reconsider that now. But cross files are identical.
It was SB 183.
Yes, that's correct. Sorry.
Lamb and Galleon. Should we? Yeah. What was the ideological commonality there? Okay. We want to keep the same vote. I assume you had a reason for it. 9-2 on HB 288. Lamb and Galleon in dissent. Next.
In House Bill 600, State Board of Examiners for Audiologists, hearing aid dispensers, duties and requirements for licenses. We dealt with this and actually voted on this yesterday and wanted to provide an opportunity for us to reconsider the hinge on the distinction between website and electronic. The term electronic sometimes defers to common usage, and in other times it's a broad and expansive definition. And that was not stated clearly yesterday. Current practice by the state board is authorizing the state board to create an electronic roster and an online lookup tool. However, the requirement that that list be made on a website is not codified. The bottom line is that they have to have some type of electronic accessible platform for their licensee roster. So the website requirement is different and is slightly expansive. And yesterday we voted with the understanding that those two were synonymous, and they're not. So wanted us to reconsider if we wanted to err on the side of the more expansive website requirement, and the electronic list, or narrow it by only codifying the electronic list requirement, which can be PDFs, CD-ROMs, if folks still use CD-ROMs, floppy drives, USB, et cetera. So any type of hardware on the computer.
We're going to take it up with the understanding that we can, if we change it, we can correct the one we voted on yesterday, as well as the House version in front of us. Senator Lamb.
I think we talked about this yesterday. When I looked at their site, there is a searchable tool for anyone that wants to plug in their license number or their last name to be able to search to see if this person's licensed or registered or not. I'm okay with that. I think that's how most of the boards actually function. So I don't want to have this board have to create a whole new system or function outside of the other boards. I think the Board of Nursing is the same way. I know the Board of Physicians is the same way too. You just plug in a last name and then you can pull up that person's record. Rather than having to create a whole new system of a list and PDFs and CD-ROMs and floppy drives. So I guess whatever the language would be to maybe make it a searchable list that's similar to the other boards, I'm comfortable with.
Do we know what the actual language is on any of the other boards?
I don't. I can do a quick search, maybe for the Board of Physicians, to see what their requirements are. I will note that the House moved on this one they amended the Senate version to conform to the House version. So we would be anticipating a conference because the two won't be identical anymore. And the Senate has already moved on amending the cross-file to reject the mandate for the list to be published.
We can always change what we did yesterday. We can change that on the floor. So that's less of a problem. Senator Ellis.
Yeah, thank you, Mr. Chairman, and thank you, Ms. Foxer, for that amplification of the differences. So I'm just concerned, I think we're concerned for the information to be available to citizens on the website. So whichever language is, they go on the website, they look up licensing, and they can find them readily accessible, not going elsewhere or have to go to a library to get special devices to find out who. So
Yeah,
That's it. Thanks.
yeah. I thought we used to talk about a searchable website, but I don't, if we want to replicate. So which language did we adopt yesterday? Or the day before, whenever?
Adopted yesterday, rejected having the list be made public on a website. And instead of having the mandate for the list to be made public on the website, we only included requiring, sorry?
We used electronic instead of
Right,
website.
so requiring the board to keep, hold, maintain an electronic list instead of placing a roster on their website.
Did the language in either of the bills say searchable website or searchable electronic? Is the word searchable used?
But I'm pulling it up once again.
Oh, she's looking, Senator Lamb.
I think if it's not, I think our intent from reviewing it yesterday was that, if you have a searchable site that somebody can just plug their name into or license number into just to verify that that person's been licensed, I mean, I would feel comfortable with that. And maybe in other parts of the statute, if it says to the Board of Nursing, Board of Physicians, or whatever, that they just need to maintain a searchable database, maybe just draw the same language out of the other. I'm not sure why this board should function any different than the other boards, I guess.
So searchable is not used. It just says maintain an electronic list.
In the other boards?
Sorry, in this particular board.
Oh.
I think Senator Lamb was saying, what does it say for physicians or nurses or whomever? Let's come back to this. I think we're going to want to make the House bill whatever is the other language, and we might have to do a floor amendment on the Senate bill, which we've already voted on. Does that make sense to folks? Okay, well, check that out. We'll come back on this bill. Okay. Ms. Goodman, how about we go to the local ones on 56?
All right. So everything on this list, these are all local bills that are not cross-filed for which we have received local letters. So House Bill 444, Prince George's County Planning Board, Non-Traditional Recreational Opportunities, Establishment and Fund. This bill requires the Prince George's County Planning Board to include non-traditional recreational opportunities as part of the county's recreation programs. The bill defines non-traditional recreational opportunities as sports, recreational activities, programs, or facilities in the county with a reasonable promise of growth in 1, popularity, or 2, participation or demand among youth populations that are otherwise underrepresented or underserved by traditional recreational facilities. The bill establishes the Non-Traditional Recreation Fund to finance and account for the development and maintenance of non-traditional recreational opportunities in the county. The bill also establishes the purpose of the fund, etc.
Yeah, thank you. Any objection to that? It's been moved. It's been second. Senator Patterson.
Right?
Passing local bill 444. Seeing none, that's done. We can do an abbreviated explanation, and if people have questions, they should just ask. Next bill, 464.
House Bill 464, Maryland National Capital Park and Planning Commission, Mandatory Referral Review. This bill establishes guidelines for a complete submission referral to the Maryland National Capital Park and Planning Commission for specified activities in the Maryland-Washington Regional District and designates timelines and feedback requirements for the Maryland National Capital Park and Planning Commission following receipt of a mandatory referral.
I'm assuming it's been moved and seconded. Anybody have an objection to this local bill? We have a letter. Okay, then that'll be moved to the floor. 801.
House Bill 801, Calvert County Public Safety Buildings Used for Agritourism. This local bill exempts an agricultural building in Calvert County used for agritourism from obtaining a change of occupancy permit if the building's use of agritourism does not require it to be occupied by more than 200 people, and the width and egress for the building meet specified building code standards.
We'll assume this is moved and seconded. Does anybody have any objection? Okay, 801 will be sent to the floor.
House Bill 1160, Calvert County Long-Term Contracts for Cellular Tower Leases. This bill authorizes Calvert County to enter into a contract for a cellular tower lease, including a cellular tower lease on a water tower, if the initial term of the lease is not more than 20 years. Anybody
have an objection or want to discuss it? Senator Ellis.
So I'm just kind of waking up. So both for HB 801 and 1180, are there support letters from the Calvert County senators with those?
Yes.
On both?
Yes.
Okay, great. Thank you.
Anybody object to 1160? Seeing none, that will be passed to the floor. We're going to hold for 977. You know, sometimes we, as chair, I add bills to the list, and committee council hasn't prepared because they don't even know, and so there's a lot of behind the scenes going on of preparing preparing the list and then preparing the backup date and explanation and the files. So sometimes it's not always in sync, particularly in the last week of a session as we're trying to move quickly. We'll come back to 977 in a moment. Let's go to 57. I think we can knock them out pretty quickly.
Gotcha. Sorry. All right, so list 57, these are all identical cross files of bills that have passed this committee unanimously. The only reason why they were not on yesterday's consent calendar is that all of these were released from rules after we had already created that list. So we could take these as a consent calendar if you want to. What? Unanimous? Yes, all of these are identical and unanimous.
Any objection? Consent on all three. They were unanimous. They just came in late from the other version. Seeing none, they will be moved as well. Lemoria, these are the ones I don't have the files on because they just got out of rules. Okay. Thank you. We're just left with 55 plus the one Prince George's bill. So we will start on 55. Well, not start. We've already started on those. Let's start with 34. Ms. Goodman?
All right. I will say, not as prepared as I usually am for this. So House Bill 34, State Department of Education and Maryland Department of Health, Maryland School-Based Health Center Standards Telehealth. This bill is identical to Senate Bill 278. It wasn't on the last one because it wasn't unanimous in the committee or on the Senate floor.
Stacy, could you, yeah, it's been moved in second. Stacy, the question was, which one is this? Could you take another?
Oh, I'm sorry. So this bill would require the Maryland State Department of Health and the State Department of Education, or essentially prohibit them from putting in standards to prevent them from operating through telehealth.
This is a cross-file of the Vice Chair's bill we heard or voted on about 5 weeks ago, I think. And there's been a problem.
No, it Ways and Means, I think it was Ways and Means. They're just moving it now.
But I meant it was addressing the problem over the last
Oh,
year.
totally, yes. So you guys may remember the mantra of this only allows primary care, behavioral care, dental care. It's that bill. It's the cross-file to that.
Any objection of taking the same vote that we did on 278 and passing it in the same form?
Is this amended at all?
Oh,
And could you just, because I think I had a little problem with this one. Can you remind me why we're changing? I know there was a lot of debate as far as numbers and all that kind of stuff. And I think a lot of the debate came to why not just tweak the process? And I think your county, in Montgomery County, wrote a letter to the wrong department and was upset that they didn't respond. Department of Health, and it was actually Department of, you wrote it to the Department of Education when it actually, the Department of Health was the one that actually did the approval. And it was stated that they weren't responding appropriately when in fact the Department of Health is the one that controlled the approval. So why not just tweak it opposed to changing the whole complete process?
You may remember that the Department of Education said that one of their top priorities was telehealth, and then they were totally putting up blockades. They weren't being responsive. It wasn't about one letter, Senator Simonaire. It was about months and months delay for the school-based health centers, the 85, 86 school-based health centers around the state, and their unwillingness to make health care, telehealth available to lower-income and rural kids. And it's been an enormous problem, and this was supposed to be an emergency thing, and it's just, but it has moved in the House, and this is the cross-file.
But if I recall, because this was a long time ago, 85% or 90% of those who applied got approval. It was only like, I think your jurisdiction primarily, and I think one other school system, and all the other ones didn't apply. So, again, it seems like a very high percentage of those who applied got permission, and then I believe your jurisdiction submitted as a block of all of them, and I think a simple tweak could say that they could approve one at a time and didn't have to wait for the whole, I don't know whether it's 7 or 8 schools applied all at one time, and I'm concerned because we're taking out some of the experts in this, and I think on the floor we heard that they actually rejected one on the Eastern Shore, probably for good cause, and under this system, they would be allowed to do that, and there's no oversight. So why are we, I still don't understand why we're taking the state protections out of it, especially when they wrote letters of, opposition or information that they believe the safety of the children would be at risk.
I'm there. I think you're relitigating the same conversations we had about the Senate version, which is fine. You can take another bite at the apple, but the answers have been, the questions have been answered. I'm happy to start reading from all the documents that my wonderful staff just brought me so that I had it in front of me. But this is important and urgent.
I mean, in fairness, important and urgent is different than the process. And when the departments say that they have serious concerns for the safety of our children, just to keep saying it's urgent and needed is not a good answer as far as why we should change the overall process opposed to just tweaking, which I think they can do. This is a complete rewrite, and like I said, on the Eastern Shore, the Department of Health determined there were certain things in there that weren't appropriate for the safety of our children, and they declined to give it to them. Under this bill, any jurisdiction would be able to do that, and you wouldn't have the oversight.
Senator, it's a process question, and this is the second time through, and I just don't want to replay the same debate. We can pull the tape out and do that. I mean, you can disagree with the urgency and everything else, but as a process, we can have the debate. If you want to have it again on the floor, that's fine, but I'm just not sure anyone's going to change. And we've
Well,
done it
that's
once.
sad, but, I mean, it's sad that we wouldn't be open-minded to that.
Well,
But the
but-
fact is, on the floor, the answers were relatively not given. It was just same thing repeated over and not answering the question. So I thought since we're in committee, we're now out in the public debate on the floor, we could actually just dive into this a little more and find out, which I think is a reasonable question, is why not just tweak the existing system that's been working for the majority of systems?
What do you want to do? It's the same bill. It's the same bill.
Yes, it's moving now. It just got out of the full committee. It's not the full body yet.
Yeah, Senator, I mean, you can disagree with it. You can try to make points. I don't know, having the same conversation a second time when the Senate bill's already passed the chambers in the House. I mean, I guess we could change this and they could, if you convinced us, but if they pass the Senate bill,
Has the Senate bill passed?
The
Third
Senate
reader?
bill,
I think it's coming on the floor.
it's on the floor for second reader this morning.
Okay, so it hasn't.
Okay.
And just to correct your facts, on the
hold-
Eastern Shore,
Let's talk process. I mean, how long do people want to discuss it? I'm going to, okay, we'll put a 5-minute cap on a conversation. I hate to do this, but there's some bills we haven't talked about at all. This one we had a conversation once, and I think we have to, give an opportunity to other bills as well. Senator Riley, and then I'll come back to the Vice Chair.
Thank you very much. Senator Hester, I'm going to include you in my comments, so I want you to pay attention. On the vote on the Senate bill on February 5th, I was recorded as a nay. On the House bill, I'd like to be recorded, I was recorded as a yes. On this House bill, I'd like to be recorded as a nay. And Senator Hester, you were excused that day, so you may want to wade in on the vote for the House bill. Thank you, Mr. Chairman.
I said 5 minutes, Madam Vice Chair.
I can defer to somebody else.
No, the lights are on.
Okay, I think we're good.
There's 4 minutes on the clock, Senator.
Yeah. I'm asking a legitimate question about process. And, what I'm hearing is, you don't have the votes, let's not talk about the process and just move on. But I'm concerned about the safety of our children. I've given examples as far as how the process was working to protect our children. There are no protections in this bill that would protect our children in those cases. I think that's a flaw in the bill. I don't think we want our children not to be safe. I think it's a legitimate policy question. And, we can debate whether one jurisdiction didn't get approval quick enough, but the facts are the majority of them did. Other ones did not even apply, and, you can complain, but if you don't apply, you're never going to get approved. And then when you look at the letters from the department, which we like to get information from them, they raise serious concerns, and it seems like we just brush over that and say this is just urgent and we want it. So I won't belabor it. I know you got things to do, but I think from a policy standpoint, this is a bad decision.
2 quick items. If people see that a division is not moving on a certain action, I can understand them not applying, right? So I think someone not applying doesn't mean they weren't disappointed and unhappy and frustrated. So I don't know how many fall in that category. I do know that people who should have been getting health care were not. And that's a problem during the pandemic. And there are people who are ready to give it, nurses and other health related people who couldn't give health care virtually. And I think that's a problem, particularly because it would have been to poor and working families. So that's my view. 2 more minutes if anybody else wants to chime in.
I'll take closing. Okay, so I'll take it. So We don't have specific data because MSDE, the Maryland State Department of Education, hasn't been maintaining it. Their website is perplexing, confusing, and impossible to navigate. I read the URL, the website, on the floor. No other providers, including pediatricians, have to go through lots of hoops. They have a piecemeal process. It's not about care for our kids. This is so that we can make sure that our kids are staying safe. And I just will tell you that between last year, or 19, 50% of the kids who were referred to Children's National Hospital due to child abuse concerns required hospitalization, 50%. Last year, during the pandemic, the exact same period of time, rather than 50%, over 86%. Kids are vulnerable right now. They're at home and they need access to health care, whether they can't afford it, can't get there physically, or rural and they can't get to a location. This has been going on. Maltreatment reports are down by 46.8% because kids aren't in schools and so they can't whisper something to a teacher or a healthcare provider. This is vitally important for them to be kept safe. So I would differ with my my colleague from Anne Arundel County. This is the bill that will keep kids safe.
Roll call.
For a half hour? No.
The motion passes 7-4 on the favorable. It will be reported to the floor. 77.
Okay. House Bill 77, Environment, Driveway Sealers, Prohibitions, Safer Sealant Act of 2021. This bill requires the Maryland Department of the Environment to develop labeling standards for a person supplying, selling, offering for sale, or manufacturing a driveway sealer for use in the state as specified. Beginning October 1st, 2022, the bill prohibits a person from 1, supplying, selling, offering for sale, or manufacturing a high PAH driveway sealer for use in the state, 2, soliciting the application of a high PAH driveway sealer to pavement in the state, or 3, supplying, selling, offering for sale, or manufacturing a driveway sealer in the state unless the driveway sealer is labeled in accordance with the bill. There are amendments in your packet beginning on page 2, and the reprint begins on page 5. Essentially, what this amendment would do would take this bill back to kind of the original form of the bill, which instead of saying you can't have any high PAH sealant as defined in the bill, it would only ban coal tar sealant products, and as that term is defined.
Yes.
With the amendments, do you know how that affects the testimony as far as those that oppose and no?
If I can answer that, because I've spoken to some of them. I'm sorry.
That's okay. I'll be right back.
Okay. The coal tar, which was the basic bill, is not used like by 95% of them. Most have already stopped using that. The amendment that raised this new category from the House drove a lot of people who are in this industry crazy because there's only one distributor and they all think it's a terrible product. So this just removes that, and I think most of them can live with it because they don't use a coal tar in the overwhelming majority of the cases. That's my understanding. And we spoke to one of the opponents who wrote a letter, and he said the same thing.
As you were talking, I pulled up the House bill, and I'm assuming that was as pre-filed, or if it was, I don't know if it was pre-filed, as presented. And it's got a whole page of unfavorable. So is that, I'm assuming that is on the original bill?
It could very well be.
Okay. Okay.
I mean,
Just so
we
I
can hold it.
understand.
I'm not, if we have no bill, we have no bill. I have to tell you. So it's a hold, request for a hold, granted this time. That was 77. 94?
Okay. House Bill 94, Environment Water Quality Revolving Loan Fund, Use of Fund. This bill expands the authorized uses of the guarantee authority under the Maryland Water Quality Revolving Loan Fund by repealing the restriction that the Water Quality Revolving Loan Fund be used only to guarantee or purchase insurance for bonds, notes, or other evidences of obligation issued by a local government for the purpose of financing all or portion of the cost of a wastewater facility, if such action would improve credit market access or reduce interest rates. Bill also authorizes the fund to be used, 1, to provide loan guarantees for similar revolving loan funds established by municipalities or intermunicipal agencies, and 2, to serve as guarantee for long-term pay-for-success contracts, green bonds, or environmental impact bonds by any public, private, or nonprofit entity for the purchase of outcomes that provide a water quality benefit. Just as a little bit of context and background, this was actually a piece of the larger Comprehensive Conservation Finance Act that this committee passed, but which hasn't gone anywhere in the House. That was Senator Rosapep's bill.
Is it in the same posture as we passed it?
This is a little narrower than what was in his bill. His bill actually, the language was a little different, but I don't think it doesn't look like that one's moving, so I don't think we need to worry about the exact wording.
Okay. A motion on the bill. It's been moved favorable. Is there a second? Discussion. Seeing none, would anybody like to be recorded in the negative? Seeing no lights, it'll be recorded as 10-01 on 94. 206.
House Bill 206, Early Election Law, Early Voting Centers, Hours of Operation. This is a cross-file to Senate 596. The bill increases the hours during which early voting centers are open for a gubernatorial primary or general election and a presidential primary election so that early voting centers are open during those elections from 8 a.m. to 8 p.m. instead of 10 a.m. to 8 p.m. This is exactly the same as the Senate bill as amended by the Senate bill.
Senator Washington.
Was this, the House bill was amended to match the Senate bill, so now it's 7 a.m. instead of 8? It should be 7. It should be amended to. So we'll have to amend it.
Okay.
Okay. that'll move
So
to
when we
amend it.
passed your bill, was it your bill?
Yeah, yep,
We amended to 7?
yes,
Okay,
And that is
so
already
we'll have to
passed.
conform this.
yes.
Any objection to that?
Nope.
Okay, we'll conform it on the bill. Does anybody have a problem? Seeing none. The Washington Squared bill. Is this the first cross-file with like-maned? Okay, we did 288, 302.
Okay. House Bill 302, Environment On-Site Wastewater Services Regulation. This bill establishes the State Board of On-Site Wastewater Professionals within the Maryland Department of the Environment to regulate and license individuals who perform on-site wastewater services in the state. The department must adopt implementing regulations in consultation with the board by July 1st, 2024. Among other things, the regulations must establish minimum standards for specified on-site wastewater systems. To support the board's operations, the bill establishes the On-Site Wastewater Professional Fund, funded primarily by license fees set by regulation, but also by a fee paid by existing service providers. The bill also establishes reporting requirements, provisions governing license denials, revocations and suspensions, and administrative penalties for violations.
Senator.
Did we have a bill similar to this on the floor last night?
So, sort of.
Sort of.
The committee has already passed, and I think those bills have already passed both houses. Yeah, on-site sewage disposal systems inspection licensing. So that was Senator Young's bill. That bill only dealt with property transfer inspections and licensing those individuals.
Okay.
This bill is much broader in scope. It would include those individuals, but would also include anybody who installs septic systems. It would include, I believe, also the government officials who do inspections as part of their work. It's a much broader bill.
Okay. The Sewage King is going to vote no. Thank you.
So, but it raises a question. Did we pass the Senate version or House version last night?
Don't remember.
We have, I think both have been passed and enrolled.
So if we have a bill that's more expansive and includes that, do we put both in place? I mean, I guess, no.
So the bills are not necessarily in conflict. This one does not, the licensing itself wouldn't actually kick in until July 1st, 2024, because it would take some time to get this licensing system up and running. Versus the one that was passed requires those individuals to be licensed by MDE by July 1st, 2022. So if both bills were to pass, the property transfer inspectors would be licensed under the program established by Senate Bill 2022 for 2 years before sort of being absorbed into this larger board structure.
One of the reasons I'm voting against this is primarily the function of the county Department of Health. They have a full staff and full inspectors to do the new installations. The reason that the Young bill passed was because 10 or 15 years down the road, at the point of a real estate transfer, the County Board of Health is not necessarily engaged. And that's one of the reasons I think this is not necessary.
Thank you, Mr. Chairman. So along with a similar bill, well, not similar, but a bill requiring licensure yesterday, I asked the same question. Does this bill define qualifications for licensure? Does it require certain experience or education?
I believe it would require the board to do a lot of that. Right, so it would require the board to make recommendations to the Department of the Environment on certification procedures and qualifications for different categories of these septic professionals, so designers, advanced treatment installers, mound installers, drip dispersal installers, etc. And then it would be up to the department to adopt regulations implementing.
Thank you. How about individuals who are in the business now? Is there a grandfather or grandmother clause in there?
That is not clear. It has a provision.
We're going to hold this till tomorrow. We can still do 2 readings in one day. It can still pass. I'm sorry, we'll take any questions and then we'll move on.
Yeah,
Senator?
my concern is, we have quite a few businesses, individuals who've been doing this a long time. And so I know a lot of these people in my district, and I just feel uncomfortable leaving to the board to say, hey, require education or something these folks been doing and don't have. Then they start coming to me and say, why did I vote for this? So this is kind of problematic for me at this particular point. So thank you.
The flip side could be that there may be some people who've been doing it for years but doing a bad job. So but I understand your concern, obviously. And that it's probably the few and far between who fit the category I just talked about. Senator Hester.
Thank you. I have both a comment and a question. I mean, I see our local environmental health boards as being overworked. They do a lot, and I really think that they need staff. And I actually contacted our auditors this summer and asked, if they could include in the Department of Health audit like a performance evaluation of whether we had enough staff at the county health departments, because they're kind of quasi-state, quasi-local. And then, of course, the audit got delayed because of COVID-19, and health departments were busy doing other things. So, I mean, if you read the information letter from, like, Team Septic, I mean, I am totally sympathetic to the grandfathering clause. I'm also aware that there's a lot of things that are currently not working. And so while we hold the bill, the question is, are there other, I mean, we've got so many licensing boards. Why, I mean, I guess, why wouldn't we have a board for these folks the way we do for electricians or for, other types of folks in this industry? And then the second thing is, if we decide to, if we do not move forward with this, I really think we need to write a letter or do a study or something to look at the capacity of this part of the health department.
We'll take it up. Sure.
So, and this, what I found, and this is kind of in agreement with a couple of points Senator Hester just made. So it seems like a lot of issues we're having at the local county levels with this kind of stuff is the lack of folks at the health department at the local level. Where I differ, though, is I don't see how having another state board overseeing something helps that problem. I think we'd be better try to work on ways to, get more employees in the local health departments than to create just another, what I see as possibly a level of bureaucracy or whatever. I think the folks I spoke to at our local health department seem like they do a pretty good job. They're just understaffed. Maybe in the upcoming we can look at some kind of law where some folks that recently retired can come back on a part-time basis and kind of help because they have the most experience, the most knowledge. So maybe some solutions like that, I think, instead of this. Thank you.
Look, we're taking up tomorrow. I really don't spend a lot of time on this. Senator Carrozza.
Thank you, because I was just, again, hearing directly on this from the county, and what I'm hearing is that the bills we already passed covered a lot of these issues, and that we also passed earlier a home septic inspector licensing bill. So it just, at this point, given the burdens that have been outlined by Senators Hester and Ellis and Gallion, and I'm hearing it as well, it just seems that this bill is not needed at this time.
Yeah, I'm not sure that's what I heard from Senator Hester, but I understand. Okay, we will take it up tomorrow. And one other question, for someone to look up, would the counties that have inspectors, would they have to get licensed under this bill? To 369.
House Bill 369, Election Law, Foreign Manufacture of Election Systems, Notification and Termination of Contract. This bill requires that contracts with providers of election systems, election service providers, require a provider to report on 1, any manufacturing of components of the election system that occurs outside the United States, or 2, any material change to a component in any stage of manufacturing that occurs outside the United States at any time for the duration of the contract. The bill also authorizes the state administrator of elections to terminate a contract with an election service provider on a determination that a foreign national has the ability to control, influence, or direct the manufacturing of an election system. There is one amendment. It's in your packet on page 11. And this is from Senator Kagan. Some context here. In 2001, there was legislation passed regarding the selection and certification of a voting system for voting in polling places that had to be used by all the counties. There was uncodified language in this bill that had a 50-50 split for the costs of paying for the voting system between the counties and the state. What this amendment does, in essence, is codify that by taking the uncodified language and putting it in the code.
Okay, first a motion on the bill. It's been moved and seconded. Vice Chair Kagan wants to add her amendment. I'm assuming that has been moved and seconded. That's before you now, the amendment to move it from uncodified to codified. It's been the practice. I don't think SB has an objection, as far as I know. Discussion on the amendment. Okay, seeing no red light or no debate, amendment is adopted. The bill as amended, yes.
I've dealt with other bills that have defined foreign national and so forth. Is this in line with the federal definition of foreign national?
I believe so, yes, because this was from a few years ago, and that question always comes up, whatever this particular bill. So, looking, yes.
So in other legislation I've dealt with, they actually reference the federal definition. Is there a reason why in this
Because it might also include components that aren't necessarily part of what they need to define for the purposes of this.
So this is exactly like the federal definition?
It's not exactly like the federal, but it is based off of the federal.
Do you know what the difference is?
Off the top of my head, I do not know.
I'm just asking, is that intentional, or is just we wanted to do it this way just to put it in code? I'm wondering, my question is there some distinction between the federal law, regulation, whatever it is, of national, foreign national, and what we're putting in here? That's the root of my question.
Let's do this. Let's move the bill, and if there's a more complete definition, we'll be open to an amendment from the floor.
Okay, fair
Is that
enough.
fair?
Yep.
And again, we dealt with this 2 years ago, I think it was on my bill, on contracts that were owned by a national firm that were then bought up by a foreign company, so they couldn't start infiltrating software that's being used by SBE. So we dealt with this to try to close the door on any nefarious activity in terms of the software. So I think this is doing it and just expanding it in terms of other contracts.
In the whereas clause, it's referenced federal law being passed, therefore we need to pass this law. So if we're referencing what they're talking about as far as foreign nationals, I think we should tie them together. That's why.
Well, I do recall in the drafting that that it was referenced, the federal, but for some reason, and I just don't have access to it at the moment, that there might have been slight components or slight differences in there, so.
the House bill so we can amend it as late a third reader. And we just want to make it as complete as possible so the door is closed on that kind of activity. Okay, any objection to the bill as amended? Seeing none, then the vote is 10-0, and Senator Riley can vote when he gets back. Okay, that completes 369. Let's hold 522 for our last bill. Let's go to 1069.
Okay. House Bill 1069, Water Supply Private Well Safety Program. The bill requires the owner of a residential rental property that is served by a private water supply well to provide for water quality testing every 3 years and disclose the results to current and prospective tenants as specified. When a water quality test reveals that a private well is contaminated, the owner must notify the Maryland Department of the Environment and the local health department and address the contamination as specified.
Is there a motion on the Senator Washington, seconded by Senator Hester? Any questions or comments? Yes, Senator Simon-Air.
I'm just pulling the bill up here. I know we had some discussions in the bill hearing. I'm paging through it. A lot of it's crossed out. Let me just get, I'm on page 7, still crossed out. So wait a minute. Some about replacing. Some people could not. I think there was the concern that the tenant may not, or the landlord may not have the money to actually make the repairs, and I think it was talking about something about they had to restore it or something. Somebody can help me find that section. It's a long bill.
Yeah, so it's those provisions are on page 9. So basically, all of the language of the bill now is on page 8 and 9. Everything else is crossed out. But it says that if the water supply
Do you have a
is
line number?
lines 10 through 18 on page 9. So when a water quality test reveals a private well supply is contaminated, the owner must notify the department, provide an approved potable water supply until the contamination is permanently remediated, and within 60 days of the date on which the owner knew of the contamination, resolve the contamination.
I'm looking at the reprint online, and the pages aren't matching up.
You need to pull up the third reader. Don't look at a reprint. You want the
sorry.
third reader of the House bill.
Yeah, under text. I just learned that a couple of days ago. On the tab text, go to the third reader.
Okay, can you?
So we're on page 9 of the third reader bill, lines 10 through 18.
Okay, I'm there. Thank you.
Yes, so this is what the landlord is required to do. So it's, I will say the language is a little vague, that 60 days they must resolve the contamination. The testimony at the bill hearing was resolved does not necessarily mean they have to do the permanent remediation by then, just that they have to have addressed the issue in some way. Yeah, that was the testimony.
Senator Simon-Air.
Can, as legal counsel says, vague, is there any way we can put additional language in there that says that the property owner does not have to repair the issue and they can get out of the contract and the renter can break the contract? Because I'm concerned that they have some water contamination. They come back and say it's going to be $15,000 to fix. They don't have $15,000, and this just simply says they have to resolve the contamination. And I don't want to put people in that situation. I mean, protect the renter, saying, okay, you can get out of the contract. You don't have to be in here. But don't put a burden on the landlord if he decides not to rent it, and it's going to take him a year to save that money to fix it. If we could fix that vague language on line 18.
question? Yes, my next door neighbor here. So are you saying that if that tenant had already been there, say, 3 or 4 years, and maybe the owner may not have taken corrective action, then at this point, then you're going to say you're going to let the owner walk away, knowing that you got some preconditions as a result of that water?
Maybe legal counsel can confirm. I don't believe this is giving them a right to legal action. It's just saying if you find a problem with it, you have to resolve it. In other words, you've been living there 1 year, 2 years, 3 years, you find out they did a test, now you found out there's a problem with the water, you're in a contract, the landlord doesn't have $15,000 to fix it.
Yeah, but I got a
But you don't want them to-
$15,000 worth of health bills.
Right. Does this deal with anything about the health bills or anything like that? I don't think the bill deals with that at all. But if the landlord can't fix it because they don't have the money.
But I can't get my life back either because it was not taken care of.
Yeah, I will say that's the one concern with allowing the landlord to break the lease is that essentially means the tenant winds up evicted.
Yeah.
Well, I mean, I'm trying to look for the solution as far as maybe it's the renter's option if they want to, but if the landlord doesn't have the money to fix it and the renter is adamant they want to stay in a place where they have it, I just think it's very vague, and I'd just like to put a little more clarification what resolve means, resolve the contamination. If we want to put in there that resolve includes and put a list as far as providing potable water at the landlord's expense, or fixing it, or I'd be more comfortable with that.
So do we need a day to work on this, or can we resolve this with amendments now?
I trust Dave. So what I'm looking for is, and I think he testified this in the committee hearing, that part of the resolution could be providing potable water to the renter, so they wouldn't have to drink the contaminated water. Or it could be actually fixing it with a repair. I just don't want it to be limited that the landlord has to fix it when they don't have the money, and then they start to go in legal battle, and then who knows if they're evicted or whatever.
So based off of the conversation that has happened, I mean, we could say within 60 days of the date on which the owner knew of the contamination, I would say resolve the issue, including by providing an alternate source of potable water, permanently remediating the contamination, or providing the option, the tenant the option to terminate the lease. Does that cover it? Or any other?
Yeah, but the first should be an and. In other words, in the short term, getting potable water, but then fixing it. I mean,
Well,
it's not.
that's already required. So it already says that they must provide an approved potable water supply until the contamination is permanently remediated.
Okay, I saw some lights. Are people fine with that amendment to the bill?
I'm not voting for the bill, so it really doesn't matter.
You oppose it in any case? Okay.
Pardon me?
You're saying you oppose it in any case? Okay. On the amendment, as council read it in response to the concern raised by Senator Simon Ayer, any objection to the amendment? Okay, the amendment's adopted. The bill's before us as amended. Senator Patterson, you want to talk to why you don't like it?
No, I don't think it provided enough protection for the tenant. I don't see, a tenant could be there, could have contracted 5 or 6 preconditions. So it seems like there ought to be some minimum protection. That person may have been there paying rent for 20 years or so, And now, you know, it's been discovered that the water may have been contaminated or whatever. And my kids and my family members, what happens? I mean, somewhere the owner has to be in some way responsible, and that's my concern. Partially or something. I just think that's too open for me to cast my vote for.
Senator Hester.
I am entirely sympathetic to what the senator just said about protecting the tenants. However, I'm speaking in favor of the bill because at this point we have nothing. Like, there is no reporting of private well water for renters. I mean, this is a huge problem in the state. And so I fully support this bill as a first step towards protecting people's health. And I'd be happy to come back and, we'll get some data from this bill. We'll figure out where this is, and then come back, and think about, how we really protect the renter. But some of these, I mean, I live on a well and a septic, and some of these improvements are really expensive. So like 60 days would not be enough time for sure. So I'll be voting for the bill.
The discussion on the bill. Senator.
So I know it's in some of these issues, and I was reading a little bit about online, I guess, with different kind of like bacteria and stuff, some property owners would just like put some bleach in or something to get something to pass. Was that ever addressed in this? I mean, it seems to me like that's kind of a temporary solution to a possible problem, unless I don't know how often you can do that. I mean, was any of that discussed or brought up? I don't remember hearing that.
Senator Roddy, you want to respond to that?
No, I have a different question.
And so I guess that kind of follows to my next question is, what actually are the once a problem is identified, with all the, so much has been struck, what are the actual requirements for correcting a problem?
So the requirements with the amendments that Senator Simonaire just offered, the property owner would have to notify MDE and the local health department of the issue. They would have to provide an approved potable water supply until the contamination is permanently remediated. And within 60 days, they would have to resolve the issue including by providing an alternate source of potable water, permanently remediating the contamination, or providing the tenant the option to terminate the lease.
So could one of those solutions potentially be just like doing that, the bleaching?
Just one.
No, because that wouldn't resolve the contamination.
So the bacteria issue is a different thing than the contamination then?
Well, I guess it depends on what the contamination is. I mean, I guess, I don't know. I guess maybe.
Can we fix this bill in any way in time enough to?
Senator.
Thank you very much. Ms. Borden, is there any penalty for not adhering to this law? There's nothing in the bill. I didn't know if there was something in current health regulations that might provide a financial or incarceration incentive to protect our tenants.
Nothing in the bill. I would have to look and see if there is a provision, more general provision of the environment article. Typically, there's like a catch-all somewhere that says a violation
Right.
is whatever. So I will have to check on that.
I am so torn because I agree with Senator Hester, we should move forward, and I agree with Senator Patterson that it doesn't go far enough. Is this ready for even a small step forward, I guess is the fundamental question for the committee. Thank you, Mr. Chairman.
I'm essentially in the same place, but right now there's no law. And so I think getting started on and coming back and tightening it up, since we have this before us, is probably worthwhile. I mean, if it were to do harm, then we shouldn't do it. But I guess without any protections, I'm afraid harm might be taking place. So I don't disagree with anything else Senator Patterson, Senator Gallion, and others have said. So I will vote for it with the idea that we should entertain even sharper, tighter, more aggressive stuff in next year or the year after. So, Senator Patterson?
Just to come back?
We could do that, or just pledge to come up with a good bill that deals with some of the issues you raised next year. Or,
Well, I think certainly we should come up with some type of penalty or something. I mean, why go through all this if someone can just walk away free and maybe?
well, they're required to do certain things, aren't they? I mean,
But
If they don't do it.
yeah, what's the consequences?
well, can we put some basic amendment in right now? There's already one amendment. It's got to go back. So I don't want to spend a lot of time because there's another
understand.
bill that's going to take some discussion.
That's why I say sunset and that maybe we can come back.
Well, rather than sunset, why don't we come up with some reasonable?
Okay,
I agree with you, Senator.
okay.
I haven't thought about what it should be. Either one of you, I don't know who came first.
I'd be happy to work with, April to try to identify a proper, penalty.
Do you have time, April?
Move it now because it's going to have to go back. I hate to do it on the fly. I really like to be more thoughtful in our work. But given that today's Friday and with an amendment, it's got to go back to the committee and then go through 2 readings over there.
All right.
Senator, you have an idea?
Yeah, $1,000 fine, maximum $1,000 fine, maximum 60 days in jail.
Yes.
I object to the jail part. The fine is good.
All right, that's fine.
I don't think we want to criminalize it. Let's keep it civil, please.
Let's keep people out of jail.
Did you say keep it civil?
Yes. You got it?
We
I'm
always
catching
try
on
to-
with the pun.
We always try to keep it civil, Senator.
It would be criminal not to keep it civil.
Right. That's very good, actually, in spite of the sponsor. Okay, any objection to the amendment of the $1,000 fine? Senator? Up to $1,000. Senator Hester?
Since since we've got 2 amendments on there already, I'd like to ask that we have a report back to this committee on what the MDE has found out.
That's fine. I mean, if we come up with another bill next year and we change the whole framework, I hate to have them go through it, but we can do that. I will count that as a motion to ask for a report from MDE on,
Implemented and what they found.
you want that back, Senator?
He said December 1st.
Doesn't take effect till July 1.
So I guess we'd have to do July, a year later, a year after the program's inception.
You don't know if they're going to promulgate regs. We can do whatever you want to do, it just government moves slowly, unfortunately.
December 22.
I'm sorry?
December 31st, 22.
Any objection? Done. Okay, we have 3 amendments.
Just clarify, the civil penalty, does that have to be from MDE or could a local health department? Either. Or we all, I heard one either and I was like, sure.
Or it could be from the local senator. So,
Make the check payable too.
okay, the bill as amended,
Can I just ask one more question?
sure.
And I brought this up in the hearing, I don't know that I
Telehealth, yes.
heard okay, so, water quality test, I don't think that's defined in here. And so somebody can go out and said, I met the qualification, I got my neighbor to come over, he did a quick test and it's good. I mean,
Term of art or not?
The original bill defined what a water quality test was. This one does not. The testimony was that there's like a standard thing you can buy, but the bill doesn't go into what would qualify.
So if a person says, I don't want to spend a lot of money on this, I'm just going to get a little, I'm not worried about the renter. I know I probably have some contamination. I'm just going to get a little quote unquote water test. I did my duty by the law. And then I don't think this bill can do anything against that. So I don't know if there is a standard that we could reference. Because you don't want people having contaminated water. I mean, it's the whole purpose of the bill.
I would suggest that we ask the Department of the Environment to identify a suitable test by regulation.
We're building the plane as we fly.
Thank you.
I'm sorry, there's another bill of controversy. What did we agree to, besides removing the chair? What?
I think the suggestion was we want the bill to work, so have MDE develop regulations what a water quality test is.
Any objection? Done. Senator Ellis, to you.
There are companies out there, certified labs that test water, so, so that's taken care of. Thanks.
The bill is amended. Senator Gallion. By the way, session has been pushed back to 1. And the idea being that committees would try to end by 12:30 so people can catch some food before the 2-hour or 3-hour afternoon session, and there will be 1. Senator Gallion.
Thank you. So I'm just curious. I'm kind of familiar with, with my district, with with the wells and whatnot that are talked about in this bill. What do in other jurisdictions that are on either city or whatever county water systems, are there requirements that water is tested too at a certain amount of time, and then if something was bad, the city has to fix it? I'm just trying to compare to see what's already being done in more populated areas.
Are you talking about municipal water systems?
Yes, yes.
They generally test the system, the water quality 2 to 3 times a day in in-house laboratories by certified technicians. So when you have, for instance, in Crofton, we have a facility that generates 100,000 gallons a day. They take no chances. 3 times a day, certified technicians, and it is very thorough in-house.
But that's at the production facility.
Yes.
It's not, they're not randomly going to 3 residences and doing.
Oh, no. They're at the source. Because the problem is houses that have lead pipes or some other type of internal environmental problem, if you test it at the tap, that's really not the county's problem.
Yeah, but for health reasons, if there's an issue coming out the tap, it's a problem for health though, right?
But the county can't control what you do inside your own house.
Yeah, but they do control the pipes that lead to your house, right?
To the street. From the street, from the meter, from the water meter to the house is the homeowner's responsibility.
Okay. All right, thank you.
Yeah.
Okay, on the bill with the multiple amendments. Will anybody like to be recorded in the negative? On 1069 as amended, Senator Gallion and Senator Carrozza would like to be in the negative, so, I'm sorry. On 1069, the bill as amended, Senator Patterson, you want to?
I just want to explain my vote. I don't know if have you finished this bill before? Are you moving on to the next bill?
No, I was taking the vote on 1069 with all the amendments we've added.
Oh, okay. I
And
just
I
want to
was
explain
asked-
my vote at
and I
the
was-
appropriate time.
Roll call on 1069 as amended.
Yes, and explaining my vote. I think with the penalty and the fact that we're going to make this a top priority to come back next year, or perhaps the next one, and see if we can tighten up the system a little bit. Because, I think about those poor people in Detroit who suffer behind the water, and the management knew well in advance of it. And, many of them will never be the same. Some of them damaged for life. And it seemed to me this owner ought to be required to have a certain level of insurance or something in case something should to happen to the tenants. So reluctantly, I'm going to vote yes.
I'm going to vote for it. I think there's a lot of amendments on here, so I'd see what it looks like on the floor, but I do appreciate the intent.
The chair votes yes. The bill passes 9-2. And hopefully we follow up on the concerns raised today about doing more on this issue that has been brought to our attention with 3 days left in the session. Obviously, there are a lot of issues confronting us, but it is an important one. Senator Lamb?
If it's, okay, all right.
Okay, that bill is done. 522.
Okay. House Bill 522, Public Schools, School Resource Officers, and School Security Employees, revisions. This bill expands the required training, qualifications, and conditions for appointment to a public school for school resource officers and school security employees. It also alters the possible uses of existing state grants, requires local school systems to adopt a behavioral health and safety action plan before assigning SROs to schools, and requires the Maryland Center for School Safety to collect and report on specified data about SROs and school security employees. The governor must include an appropriation of at least $100,000 annually in the budget for the center to complete the specified studies. Finally, the bill prohibits an SRO from enforcing a school student code of conduct except under specified circumstances. There is an amendment mostly drafted in that reprint I plopped on your desk a little bit earlier.
Looks like this, colleagues.
Reprint. Okay.
So because it's mostly striking, I didn't include the actual amendments in that packet because it would mean nothing. So if you want to go through page by page, that'll probably be pretty helpful. So on page 3, that's a House amendment. They just struck that language in from the original bill. On page 4, this is also in the bill as it came to the committee. This requires that the center, the Maryland Center for School Safety, in consultation with school systems, to develop a specialized curriculum that includes training on various issues, including restorative approaches to discipline and identification of conduct prohibited under certain subsections, which will likely change due to some of the changes suggested in this amendment. On page 5 of the reprint, so the House bill had a requirement there be a joint determination of an assignment of an SRO between the law enforcement agency and the local school system. These provisions were struck. And then on page 6 of the reprint, there's provisions that were added. So before a...
Go through the whole thing.
At the bottom of page 5, it says, beginning in September 1 of this year, to be employed as a school security employee at a public school, the individual must complete these requirements. The House added passing a background check that reveals no findings of excessive force, child abuse, crimes of violence, or assaults in the second degree, or a violation of an ex parte order, and then meet any other criteria adopted by the center. Those were additions. The next parts deal with hiring or not assigning school resource officers to a school unless there is a behavioral health and safety plan, which was adopted by the House, and that has been struck in this reprint. Also added by the House was a requirement that a school resource officer not inquire into a student's immigration status or of their family member, that a school resource officer under investigation for excessive force has to be reassigned immediately and can't be assigned to a school until the investigation has concluded with a finding that excessive force was not used. On page 7 of your reprint, starting that paragraph 2 is all struck, and that dealt with SRO supervisors and meeting requirements. In the middle of the page, beginning in September of this year, the center would be required to develop a specialized curriculum to train a school resource officer supervisor in the requirements of this act. That's some language that will have changed. On line 21, it says of this paragraph, but a lot of that paragraph was struck, so I have to go back and make a change there. In lines 22 through 24, beginning in August of 2022, all school resource SRO supervisors have to complete the training that's developed by the center. Beginning in September of this year, the center is required to develop the specialized curriculum to train school administrators. This amendment would say to be used by the department and county boards to train school administrators instead of the center doing that training. The provision about proper disciplinarian roles was struck. But the training would include de-escalation techniques, mediation, restorative approaches, methods of conflict resolution, and crisis techniques. I'm almost there.
Aren't in this printout?
Yes.
Walking through the printout.
I thought I heard her say she's going to put some stuff in here that's not.
I did. I mean, it's a note to myself because there was a drafting error.
Yeah, 1 second said in this paragraph, and a lot of that paragraph was struck.
Right, but she also said something about who's training, you're going to change who's training.
Right. So if you go back, I'm sorry, on page 7, in lines 25 and 26, as the House passed the bill, the center would provide this curriculum and specialized training to school administrators. The amendment by the Senate, or the amendment here, would say to be used by the department and county boards to train school administrators.
Okay, just from a process standpoint, where are those amendments that you're referencing?
As I explained earlier, I didn't include a copy of the amendments because it's mostly striking. This reprint includes the amendments that I'm talking about.
This printout does?
Yes.
So
This
on
is a
line
reprint of the
25
proposed amendments.
Okay, folks, no, we want to be clear on what we're doing here. The underlying caps came from the House. The underlined italicized caps are the new amendment. So in other words, 25 through 29 comes from the House, but if you look on line 26, by the department. So essentially, the training is developed by the center, and then it's given to the police department and the county boards of education to train folks. Just clear the chain of command.
That's fine.
Okay, no, that's.
Moving to page 8 of the reprint. So beginning in August of 2022, the center may offer the training versus the House version that said would require offering the training to be developed under that to the department and county boards for all school administrators. So essentially, what that would do is that instead of the center providing the training, the center can offer that training to school administrators. And then, let's see here, there's a line struck on 11 through 13. Those lines are stricken in this amendment. That's not a House, that's the Senate. So D1 would strike that a school security employee may not arrest or otherwise detain. That is stricken. And it retains the language in 14 through 16 and 17 through 20. So it says a school security employee may not inquire into the student's immigration status or the family's immigration status. And it requires a local school system to employ a school security employee to establish a complaint process modeled after the process in Section 3519 of the Public Safety article. And then it also provides, this is the House language, that a school security employee who also has an allegation of excessive force has to have the same standards as an SRO who's also accused of excessive force. On pages 9 through 11, that established the Behavioral Health and Safety Action Plan. All of that language has been stricken in this proposed amendment. On page 11 of your reprint, the House version of grant flexibility had struck any local law enforcement agency from being allowed to apply for the grant money, only local school systems. And then there was choices that they could spend it on, but only one of the choices versus others. This is the Senate language that the work group earlier this session had agreed to. So the proposed amendment would allow law enforcement agencies, we put them back into this bill, to assist in meeting their requirements under this provision of law. And it provides grants to local school systems and then gives them some choices. So they can, a local school system could assist in meeting the requirements under subsection F, or they could hire and contract with school psychologists or community school coordinators. And this was the grant flexibility provisions that the Senate had previously agreed on. The stricken language at the bottom of page 11 and at the top of page 12, all related to the House's version of the grant flexibility. On page 12, this is a provision requiring the center to collect data on incidents of uses of force. As you can see starting on line 13, the House added language that required the center to collect data on incidents when a school resource officer detains or searches a student, and when a school security employee searches a student. Beginning on, on line 23 of page 12, there's an annual reporting requirement beginning in 2022 that we're requiring the center to report to the governor and the General Assembly on various information. On page 13, the center is required to review information required to be collected under this entire subtitle. Subsection C talks about synthesizing that data into best practices for school resource officers and school security employees. It requires them to adopt key performance indicators that can be used to identify an SRO or a school security employee whose performance exemplifies the center's best practices. And then beginning in 2023, the center is required to share the key indicators developed with local school systems and local law enforcement agencies. And at the top of page 14 in your reprint, the center shall incorporate the best practices established into the training required for SROs and school security employees. Let's see here. So on page 14 in the middle, starting at line 14, you'll see the center is required to perform following. Existing law requires the center to perform various functions. They have to conduct certain research, and there's a provision added to that, and that the impact that school disciplinary action and assignment to juvenile detention has on students' educational and economic outcomes. And let's see here. And the language on page 15 of the reprint, the language with the mandatory appropriation for the center was stricken.
Okay, let me give some context for this. Look, this has been debated, is being debated, the role of SROs. Some people don't want them, some people want to use them more effectively, whatever. Senator Ellis introduced a bill initially that prohibited them, and then we started to work on amendments that put some restrictions on them. We held that bill because the House had a whole subcommittee working on this. They had one set of amendments early in session, then they said, no, we're working on more, and then they finally sent over their version of the bill, I don't know, a week and a half ago, maybe, I don't know. Then the Senate President's Office had some serious concerns on a number of issues, and they asked the chair to hold it. They have shared the amendments with us in the last 24 hours and have now said, given that other things have gotten out of the way on the floor, if the committee wants to move it, they can, but they are strongly recommending the amendments. So they trimmed down what the House did. It doesn't say you have to have SROs or you can't have SROs. It does say you can use the money for other proactive things like social workers and counselors if you choose not to spend it on SROs or have SROs. And then, obviously, as Ms. Goodman said, there's required training and a number of other aspects. So that's the context. That's where we are. So with that, let me open up the floor. I think I had Senator Hester first.
Motion first?
Sure. It's been moved. Is there a second? It's been moved and seconded. We'll start with Senator Hester, then go to Senator Riley, and then Senator Kagan.
So I guess the question is, I had looked a little bit earlier at another bill that required training of the school administrators, and now it looks like the center is going to develop training, which then the administration will roll out. I still wonder if there is enough staff at the center to get this done. I understand that they have 6 staff, and that in 2019, when they did the first round of SRO training, it was like crazy hard for them to get it all done. And so I really I'm supportive of this bill, but I really want to make sure that the staff don't get overworked.
Riley, Vice Chair Kagan, Senator Patterson, Senator Webb. Okay, then Senator Gallion. We'll probably have to go around the room.
That's fine.
Senator Riley.
We have 45 minutes. All right, Mr. Chair, where's the center? Where's the center?
It was established 3 years
physically.
ago. Is it Bowie State? We're checking on that.
Okay, because I'd love to go visit. Anyway, that's an aside from the bill.
I think it's an office. I'm not sure you're going to see, cuffs and guns, but.
No. They have 6 employees. They're doing training. I don't know. I like to kick the tires. Okay.
Yeah, and I think the training is being done on site in the counties, but.
Okay.
We'll see.
That's
we'll
fine.
get back to you on that.
That's fine. Ms. Goodman, right? Is there a definition of school security employee in the bill?
No.
Do you know what the intent? I know what an SRO is, badge, uniform.
Mm-hmm.
I've never heard of a school security employee. Is this a
They're
new?
essentially school security guards.
And Are they prevalent in our school systems?
I don't know the
I don't
answer
know.
to that question, but we actually have some existing law on the behavior of school security employees.
Okay. Yeah, I never heard one. If you would be so kind as to go to page 11 of 15, and under line 18, assist in meeting the requirements of subsection F.
Right.
I'm trying to find subsection F. What page in line would that be on? Because it's also referenced on page 9.
Yeah, so it begins at the bottom of page 8
Okay.
and at the top of page 9.
Okay, so when I go back to page 11, it talks about providing grants to local school systems to meet the requirements. So when I go back to page 8 at the bottom,
It's a data collection section.
okay, so some of the money can be used, grants can be used to assist in data collection.
And, let's see, initial data and develop guidelines to assist local school systems in identifying the appropriate number and assignment of school resource officers, including supplemental coverage by local law enforcement agencies, and collaborating and communicating with local law enforcement agencies.
Okay, so again, I presume this is being done at the center, wherever that may be.
Yes.
Okay.
It's in Baltimore, by the way.
Oh, Baltimore.
I think it used to be at Bowie, and then it moved.
All right, well, anyway, I'm interested. I think I had one more question, Mr. Chair, if I can go through. On page 6, line 26, it talks about the school resource officer may not inquire, and a under the next paragraph, under investigation. Why not school security officer? Why just one and not both?
Well, if you recall, that was later in the bill. There was another, it was put in at a different spot.
Oh, okay.
It's on page, hold on.
I got it, page
It's in there, but
8,
yeah.
line 14.
Yes.
Okay, very good. Mr. Chair, I think, yeah, that's all I had. Thank you.
Thank you, Mr. Chair. I have 3 amendments I'd like to bring before the body as Ms. Goodman was going through it. Would this be an okay time, and I can do it briefly? I suspect they are not going to be that controversial, but I've been wrong on that before. Okay, so on page 6, line 31, and on page 8, line 22, both of them are referencing if an SRO, a school resource officer, is under investigation for using excessive force, that they should be removed from the school right away, and then that they shouldn't be sent to another public school. And it seems to me that while I'm not a fan of giving public money to non-public schools, I don't think we want these possible bullies or violent people to be reassigned to a non-public school. So I would think that we might want to indicate that they shouldn't be reassigned to any school, public or non-public. So that's my first one in 2 locations.
Yeah, this is only for the public school system.
Yeah.
It's
Okay,
not-
but
Am I wrong?
Yeah, I mean, non-public schools are not part of the SRO program, and I don't know of any non-public school that has any law enforcement officer that's assigned to it as part of a program, so.
there's
This
no
was
chance that
established-
could happen.
This
then.
was established 3 years ago or 4 years ago when we had the student shooting in southern Maryland.
Right.
My belief it was only for the public school system.
Okay.
Because there were other requirements of security and protection which did not include non-public schools.
Okay, so I guess we will hear back from anyone watching or anyone else on the committee if that's not accurate, but if that's not a problem, then that's not something we need to fix. The next thing is on page pages 12 and 13. They're talking about the ratio in the previous year of school resource officers to a public school as compared to the number of students, the number of teachers, the number of administrators in both places. And it seems to me that I just want to make sure that the definition, teachers, would that include para-educators, support personnel, support people, aides to people to students with disabilities? I just want to make sure that that is covering when we're going to get the data that makes sense that would apply to all schools.
I think teachers means teachers. It does not mean the support personnel.
So it seems to me like that would be important, helpful data, since some schools might have more of those support personnel than others. And so again, number of adult bodies that would help deal with discipline issues. So don't know, Mr. Chairman, whether that's something you want to consider or move on.
Anybody can move any amendment. I think if it's apples to apples, and if everyone's using the same definition from year to year and school to school, I think that's sort of what's crucial in terms of what becomes the baseline.
Sure.
So
I
you
think
can move any
apples-
amendment you want.
Okay, apples to apples. It seems to me that there are some jurisdictions that have funds and priorities and a need for the student body and all that, and they don't have just teachers, but they have para-educators and they have support personnel and others. And again, when you're talking about discipline and keeping student bodies functioning well, sometimes it's more grown-ups in the room that's helpful. So I'm going to propose then, and Stacy, I'll defer to you for what language, but after number 2 and before number 3. So number 1 is students in the school, 2 is teachers. I'm sorry, I said page 12, lines 29 through 31, and page 13 at the top of the page, lines 3 through 5. So right now it says students, teachers, and administrators, and I'm suggesting that between teachers and administrators that we add, is that professional staff? I don't think it's the number of, cafeteria workers and stuff, but I do think it's support personnel and others that are available in the classroom or in the school.
Okay, is there a second for the motion? Discussion. Yeah, again, I'm just, every school has support staff. I mean, if you have the same baseline in every school, I think it's just going to be extra work for who's ever got to compile this report. They have to do it once for the number of teachers and once more for the adults, but the ratio is going to be pretty similar. I understand your concern, then I think we should take out teachers and just have professional staff. But I think we're overanalyzing the kind of work and the kind of results we're going to get. I think we're going to get the same results whichever figure we use. And we're going to be able to compare them because every school has support staff, special ed, aides, and lots of other things. And so either you total it all up and you use that number or you use professional teachers who are certified teachers. But I think if it's a baseline, it's a baseline, and it'll go up or down each year, although I think most schools don't have too many more than one. So anyway.
I'm fine. I would see it as a friendly amendment if you expand the definition, the verbiage of teachers. I'm not going to press this super hard if nobody else thinks it's a good idea. I also don't think it's that hard to count the number of people you're paying in your school. And I think if you're in Somerset County, you probably have fewer paraprofessionals that are afforded there than you might in Howard County. And so I just think that data is useful. So Senator Crows, I don't know. What do you think? And if not, we can move on. But anyway, and then I had one more amendment.
I actually support that amendment. And again, I appreciate the sensitivity, especially in the rural areas.
Okay. So what is being proposed?
I defer to the verbiage, but I was suggesting after teachers in the school that there be something like support personnel or paraprofessionals or whatever. I defer to Ms. Goodman on what the appropriate language would be, but They may not be teachers, but they may help with discipline, oversight, supervision, socialization, all the other stuff that we hope to need less of as we dial back some of the SRO presence or role. So we can, go ahead. What do you want to do?
No.
I'm happy to move on or not.
The other, whatever, let's go to the next one.
Okay, the last amendment that I have, Ms. Goodman mentioned grant flexibility. This is page 11 of 15, and it's the section starting with line 18. And it says that it's school psychologists, social workers, school counselors, behavioral specialists, to expand the availability of school-based health services and behavioral supports for students. And I'd like to propose, it would be the school's choice, but I'd like to propose nonprofit organizations, and I can give 3 very brief examples in Montgomery County for organizations that are super effective at mental health support and student counseling. One is Every Mind, which is the former Mental Health Association, does suicide prevention and support. One is You Matter, which is a teen-led suicide avoidance and collaborative thing. And the other is the Conflict Resolution Center of Montgomery County, or CRCMIC, and they do collaboration, mediation, anger management, and stuff, classes in the schools in Montgomery County. And I suspect that these types of organizations exist all over the state. So I think it would still be, it would provide just a smidge more flexibility with the grants. So I would like to propose adding nonprofit organizations.
Would that include, I think Planned Parenthood is nonprofit, aren't they?
It's a fair question. That was completely not my intent, but if you want to tighten it up, and they are not known as mental health providers. They are.
Yeah, I would just want to make sure they're not included in that.
That's totally not my intent. So, nonprofits related to mediation and mental health care and. Again, I defer to Ms. Goodman on the language.
Yeah, well, how much per count is it? Is it 10 million total, Ms. Goodman?
Yes.
And that's spread over 24 jurisdictions?
Yes. Law enforcement agencies.
I'm sorry?
And law enforcement agencies. I mean,
Okay.
the grant is for both, so.
Yeah. Senator, as we've done work with schools, they have all said they don't have enough psychologists or social workers, and even the ones they have are barely doing any counseling. This could be $40,000 to, or $100,000 to a school system. I don't think, even if it were to get one additional social worker in the high school to try to get to those troubled students who might potentially be a problem, it won't go very far. So I think targeting it to the school systems, and as much as I want to help, and there's some wonderful nonprofits in every jurisdiction, the schools don't have enough therapist-type people who can actually counsel students, and I think they're competent, and I think expanding this when we're talking about crumbs of money anyway, I think sort of takes us in another direction.
So I'll just speak to that, and then I can withdraw my amendment if there's no second and no other support for it. Rather than hiring a salaried, benefited, full-time, or even part-time mental health professional, some jurisdictions may be able to make a grant of a couple $1,000s to have a nonprofit available in providing services. So it is an affordability question as well as professionalism and service provision, and it would still be the schools and the school system's choice whether and how to do it.
I'm very supportive of bringing in nonprofits and everything else, but I think we're at a critical point in our school system that we need to look for professionals who can adequately come in and do the job. You got hundreds of nonprofits. How are you going to select the one to come in? I think this get to be, and of course they got to go through all the ID and checking and that kind of stuff. I just think we need professional folks to come in and do the training. And we're talking about a person like this, like we don't even have nurses in our schools, and that was the time we had one or two. Now you got one nurse serving 3 schools. And, there are some critical needs that has to be taken care of on the part of students. And I think when that's the case, we need professional folks to do it.
I will withdraw my suggestion.
About 3 more people on the bill, and I've sort of lost my order. I think, Senator Patterson, did you want to speak on the bill in general?
Yes, I just got, am I next in line? I know we're getting late. Am I next? Yes. Okay. I'll be very brief, but it's getting late. I guess I'm just concerned about the overall process of implementation here. This is a major, major undertaking, and I wonder about the cost. Well, can we use some of the blueprint to education? Can some of those monies there be used to implement this portion?
Well, most of it is directed. We can take it from tutoring of kindergarten to 3rd grade. We can take it from money for wraparound services. I mean, it gets complicated, Senator, a lot of that was targeted with purposes. Mm-hmm. It's not like there's a lot of soft money. I mean, it really is to do very specific things. So, look, might we get more federal money and it might help? Yes. I mean, the governor has to put in the $10 million in the grants. Mm-hmm. This is expanding it where it doesn't have to be for the SRO. It could be for the psychologist or counselor. Mm-hmm. But I think at this point to start taking money from Kerwin, I think might be a mistake.
My other follow-up question, I can't find it now. I think I had it marked, but it make reference to those troubled students that may have to go to detention centers. Will the money of the student go with the student when they're transferred to a detention center?
That's not in this bill, and I'm not sure the answer to that, but I think there is funding, education funding. I don't think it's good enough, and Chairwoman Kelly has been working on this issue in detention centers. It's been inadequate. But this bill doesn't touch at all.
Okay, but last question. How about the unions' involvement here? Because there are teacher unions and everything else. When you start implementing special programs, will they have to be brought into the equation?
As I recall, they supported the bill with amendments, and their major amendments was on the training.
That's what I'm talking about. Yeah.
And, I couldn't find their amendments, and I know I've been being texted. I was trying to figure out language that when the center develops the training, they consult with other stakeholders. I couldn't find the language. So they're aware of this. They're following this. They're listening actually now. Okay. So they supported the bill with amendments.
All right. Thank you.
Yes.
One thing, Senator Riley asked me if there was a definition of school security employee. Apparently in the School Safety Act, there is in fact one. Someone was kind enough to point it out, and it means an individual as defined in regulations adopted by the sub-cabinet who is not a school resource officer and is employed by a local school system to provide safety and security related services at a public school. You're welcome.
Followed by Senator Gallion.
Yeah, thank you, Mr. Chairman. So this bill gives me a lot of pause because I have some concerns. I do want to echo what Senator Hester was saying when it comes to the center. And I know the center was created a few years ago, but I don't think it has the expertise that's required for everything that we're overlaying on top of them. It's, it seems like it may be 6 people, it's somewhere. But it's mostly comprised of people who have expertise, I think, in disaster response and school policing. I don't think they have much experience in restorative practices, restorative justice, which we're asking them to do a lot here in that regard. And so that, and on top of that, we're also not providing the additional funding for them to do that. So I'm just not sure all the responsibilities that are overlaying on top of the center are a good idea. I'm also concerned about, the fact that SROs aren't limited really in what they can do in these schools, because they can still do anything that would be considered a crime. And when it comes to a lot of the things that are considered disciplinary problems in these schools, they oftentimes will still fall under, what could be considered a crime. If someone's horseplaying in the playground and pushing someone, that could be considered an assault, et cetera, et cetera. There's a huge loophole here, I think, that opens up SROs to still be involved in a lot of these things that I have concerns about. And I'm also concerned about the fact that the $10 million that's being allocated to SROs, while we're opening it up for other programs and services, it's still optional. And I think there's a lot of, as we've kind of cited earlier, behavioral health needs that I think this could really be more strongly directed to. By creating it as an optional, I think it's still leaving out a huge loophole where this funding could really be directed to SROs. And I think I've heard that even in Charles County, they're using this funding to be able to send SROs to elementary schools. And this provision, while it gives them more options to be able to designate that funding for, it's really just an option. And so, this whole bill just gives me a lot of pause, and I'm just not sure that I can support it in the current form.
Thank you, Mr. Chair. First of all, I noticed the time. I have several questions. Are we going to try to have lunch before 1 o'clock, or are we going to skip it? Okie doke. So, first question, and the center. My question is, and I think Senator Lamb kind of talked about this a little, so did Senator Riley, so I wanted to follow up. We went through really 3 years of the Kerwin debate and talking about the different things there. How does the center play in with Kerwin, and was it even referenced in Kerwin anywhere?
Maryland Center for School Safety is not mentioned in the Kerwin legislation.
So if we're doing this that's relating to schools, why wouldn't we try to fit it in somewhere that's addressed in Kerwin that we spent 3 years on? Why would it be the center that I've never heard about before today?
Well, the Maryland Center for School Safety was established several years ago, so this is not new per se. Kerwin was not related to this particular issue. It was more about teachers, and I think Senator Pinsky could probably answer the question better than I can, but this is kind of a separate, very specific issue related to school resource officers.
This was an initiative of Governor Hogan, again, after the student was killed in Southern Maryland. I can't remember what school.
Was the center his initiative too, or is that before it?
No, that was part of the bill. It created a center. It dealt with school response and security in terms of violence. It put in the $10 million grants. It set up the SROs. It said that jurisdictions had to be able to respond to a shooting within whatever 5 or 10 minutes. If they didn't have a school resource officer in the rural areas, they gave money to supplement that. So it was a major package.
So in other words, this, and I appreciate you explaining this because I'm learning about this. So basically the center was directly tied to the beginning of the whole SRO thing then?
Right, but the SRO was only a small part. In other words, they also wanted a review of the security in every school or every high school in the state. I think there was money for redoing security and in some cases having metal detectors and police response to shootings. It was much more than that. SROs was a small part. Well, it was one of many pieces of that initiative.
Okay.
Which still had to go through the legislature. I think JPR handled it back then,
Okay.
which I voted against.
So, thank you for kind of clearing that out some, because I hadn't heard that. So, page 5 of the bill, some of the, I think starting like around line 18, it was struck out a part that said, beginning in August 15, 2021, a local law enforcement agency and a local school system jointly shall determine the assignment of a school resource officer to a public school. So if that's struck out, who would make the determination of where someone's assigned? Is it that the center, or who would?
So the current practice is that the law enforcement agency makes the determination and assignment.
So basically, before this was struck, it would have made it the law enforcement and the school system.
Correct.
Okay, so this just would take it back to what it was before then.
Correct.
Okay, thanks for clearing that one up.
Okay, I'm going to interrupt for a moment because I think I've got some sense of the body. I think there were significant concerns, and I've already had one request to hold this for this session and to look at it. I'm not sure it has 6 votes at this point. However, right now, the SRO grant must go to the SRO officer. It cannot be used in those counties that don't have an SRO officer, but might want to spend it proactively on counselors. So I would say we have 2 choices because I'm not sure there's 6 votes to pass the bill in its general form. We can either hold it, or we can strip the bill of everything except where it allows the flexibility of the funds to go to proactive counseling and send it back, and they can say thank you or no thank you.
Now, that wouldn't take any funding away. Is the fund big enough that it wouldn't take any funding away from the current areas that have the program and like it the way it is? I mean, it wouldn't take money away from them to pay for other things in other areas, is what I'm asking.
No, my understanding is right now, the $10 million will go to those counties that ask for a grant to help underwrite the cost of their SROs. And I think most counties have SROs. A number of them are debating getting rid of SROs, and maybe there are a few that don't use SROs. So what I believe, and I said this before session to a number of people, if a county didn't want to have an SRO because they didn't think it was appropriate, but they wanted to hire another counselor or 2 to reach troubled youth before they pull a gun and shoot their fellow students, they should be allowed to use it, not just in responding, but in being proactive. So I can't tell you exactly how the $10 million in grants is distributed.
Okay.
Yes.
If I may?
Yes. If Senator Gagnon.
Yeah, it's in relation to the question. I can only speak to Anne Arundel County. The funding for SROs in Anne Arundel County is included in our school budget, not in our police budget. And number 2, if more money was made available by grants, whether it's for SROs or for psychologists or whoever, I think the school system would appreciate the extra opportunity to gather money.
So this is additional funding to what's already in the current
Well,
program
that's what
now.
Anne Arundel. I can't speak to any of the other counties. Thank you, Mr.
Well, I'm talking
Chairman.
about this grant you're talking about. So is that additional, would that be additional funding coming to these different counties in addition to what they're already using now, however they pay for it now?
This money doesn't pay for it all. It is a small grant. If you take $10 million over 24 jurisdictions, I mean, I don't know how many there are 100 high schools. If you had, that's $10 million there, right? There are probably more than 100 high schools. Well, I'm sure there are more than 100 high schools. If there are 100 high schools, $100,000 each, that's $10 million right there. So, I think most counties, and I know in Anne Arundel, they're spending a lot of money, of their own money, paying for SROs. I just think if a county doesn't want to have an SRO, but think troubled youth and the response and keeping things calm in a school, they should be able to use it. I don't know how it plays out, if it might mean $5,000 less or $20,000 less. I don't think they should be penalized.
And wouldn't there be some areas that may want to use it for both?
Well, yes. But in other words, if Cecil County, there's only so much money. In other words, there's not enough money to give an unlimited to every jurisdiction. I mean, again, 10 million divided by 24 comes to $250,000, I think, if they were on average. And if you have a $65,000 salary and benefits, that's $100,000. It'll pay for 2.5 people. And if you've got 20 high schools, it doesn't pay for a whole lot. So all I'm saying is any county can put in for however much they think they can get, and they can use X for a SRO and Y for a counselor. We're not limiting that. We're just, right now, you can't use it for anything but a uniformed officer. So, okay, again.
But honestly, this is a lot. We're talking about a lot of different things, and I'm a little uncomfortable voting on something if I don't have really any time to kind of, this is a big issue. My office has gotten more calls about these pieces of legislation than anything else this session.
Right,
I would just like to
we're stripping down 95% of it.
Right.
And if we choose that out, look, we can hold the whole bill, or I throw out another option which maintains about 5% of the bill. None of my calls were about whether this can be used for a counselor. Not one of my calls. It was about, should we have SROs or not have SROs? It doesn't touch that issue. So let's, it's getting late. Let's try to narrow the conversation and come to some resolution, folks, as a consensus. Senator Washington, followed by Senator Carrozza.
Thank you. So, colleagues, I think our small work group, I guess it seems like years ago, but I guess it was where we were talking and when we were contemplating Senator Ellis's bill, and then we've gotten a number, is that I think the place that we came to is that this is such a large issue, and it's multidimensional, and that we said we wanted to do a summer study to really come up with something that is much more complete, and that the amount of time that we spent on, police reform, when we're looking at the role of SROs, when we're looking at the role of police, when we're looking at the criminalization of discipline, the school to prison pipeline, that it does require that level of effort. I don't think that this bill does that. I am attracted by the idea that does address one of the problems that you have to being able to spend money on additional programs or alternatives to security and policing, that if we allow that as an option, I think that that's a good sort of bridge to allow us to move forward and to come up with something really substantive next year. So that's where I am. This is not quite enough, and it potentially creates more problems than it's solving, I think, in its current form. So. Flexibility, that second scenario, I think we have some consensus on that. If people want to spend it as they always have, then they can continue to do that. And if they want to be able to be allowed to use these dollars to spend on behavioral health specialists, or that they will be allowed to do that, I think that is something that I think as a committee, we would get consensus on.
Thank you, Mr. Chair. And this has been a really important issue for us all session. And I appreciate that my colleague, Senator Ellis, brought the issues here. My reservations all along have been that this program is highly successful in several areas. So with that as a background...
We're not talking about the program.
Okay, so...
Either we're talking about
so
holding the whole bill or allowing flexibility.
So the reason I believe any changes at this point with us doing it on the fly, we haven't even consulted with the Center for School Safety to know what that means across the board. And even though we're saying they can still use their money for SROs, but then they can also do this, there could be an unintended consequence that affects the current SRO program that is working. I like this idea of doing a work group and actually looking at all of these issues, because my understanding is that the center is already doing MOUs with the locals. I think we need all of that information to work on this over the interim, and I pledge to be, a constructive partner in that, because I believe this is so important. But for us right now, trying to get to the floor at 1 o'clock to say, okay, let's just change a part of the grant program, and not even know if an unintended consequence could jeopardize the current success of this program, I can't support that.
Okay, the motion before you is to amend all of the bill except allowing flexibility for the use of the grant money for proactive counseling, et cetera, what was in the bill. So that's the amendment before us. Stripping everything else out, retaining that. Roll call. The amendment, which will become the bill, but right now it's to strip 80% of the bill or 95% of the bill and just keep the flexibility section. Eight in favor, 2 for, 1 abstention. I'm going to take a second vote, which will probably be the same because that was on the amendment. On the bill as amended, it's the same debate. Would anybody like to change their vote for the final bill? Which? Okay. No, we got that. Okay, so then it'll be 8-3 for the bill. Gallion, Carrozza, Simon Ayer voting against the bill as amended. The other 8 voting for it. Senator Ellis, you want to?
Well, if that's done, I'd like to.
Well, okay, so that's done.
Okay. So, Mr. Chairman, during the discussion with my bill, it was I know you're very busy, a lot of issues, and the agreement was that we'll conform Senate Bill 0245 to the bill that came out of the House. Could we do that and move that bill also, Senate Bill 245?
This is your original bill.
This is the Senate version, right? We just finished with the House version.
Sure. Anybody have any objection? And Senator Ellis started with Bill 11 weeks ago. Any objection to passing the bill by the same vote?
Change the title SRO Now Act or something like that.
245, yes, sir.